Hello and welcome to another short debrief from EULAR 2024. My name is Tiffany Westrich Robertson. I am the CEO and original founder of AiArthritis, International Foundation Autoimmune Autoinflammatory Arthritis. I'm also a person living with non-radiographic axial spondyloarthritis, which is very relevant when we're talking about what I'm going to talk about today, which is, wait for it, prevention? What? We all know that our diseases are not curable at this point in time, but did you know that we've been talking at these research conventions in rheumatology for, I'd say, about 2 or 3 years now about remission, which is also a word that we don't hear very often, pulling or tapering people off of drugs, which I'm going to talk about in another debrief. And in this one, the title was Prevention Learnings, Where Do We Go Now? And the studies that were shown were largely showing rheumatoid arthritis, but that does not matter if that's not your diagnosis. And here's why. Research often in our diseases starts with either one of two. It'll start with rheumatoid arthritis because it's the easiest to study and then applicable to other diseases, or you'll see studies in lupus. And that's because lupus is one of the more complex diseases. So when we have to think about complexity, often it'll start there and then trickle. So that's why you might see more research in those two diseases, but it's because it's applicable for then researchers to build on those studies into other diseases. So that's why that's important for you to know. And my personal story, I was originally the mystery patient. I was diagnosed finally after about 6 months with undifferentiated connective tissue disease. There's a lot of different undifferentiated. But the point of saying that is that would be considered early RA, early arthritis, early inflammatory arthritis of some nature. And unfortunately, most of us, our diagnosis is delayed, and then we have delay to treatment. That's what this is all about, showing how we could possibly even prevent our diseases from starting from onset. Interesting, huh? And in my personal story, I was originally diagnosed with finally with rheumatoid arthritis, but it was not rheumatoid arthritis, seronegative, which means there were no inflammatory blood markers. Then in 2013, non-radiographic axSpA, because that diagnosis actually did not exist until about 2012. So that's a whole other thing. But the point in saying that is, again, it just took a while to figure it out. And I did start as that inflammatory arthritis. We all start somewhere. Think back, oh, that this could have been onset before our like full-blown disease. So that's what they've been talking about. They've been talking about, first of all, dividing the preclinical disease into various phases. So up until this year, I had seen preclinical, which means this sort of symptoms of inflammatory arthritis. You may or may not have positive blood markers. That's the earliest signs. Do we treat it to try to prevent it? And then now you're in full-blown disease or you're not, and then we move forward. Okay, so those are the divisions. Now they're talking about, because of all these studies, moving it actually into two pre-disease subgroups, which I need to learn more about. But the findings were, they went back and they looked at all of these studies that had happened. So I'm looking at my screen here so you know that all have happened over the last 10 years or so. And then they did a review. So one of the examples was defining what is early preclinical RA or early preclinical disease. And essentially regardless of the study, they all had the same things in common. You could not have any indication of synovitis. So nothing of the synovial inflammation. But you had to at least be presenting with something that seemed like arthritis and seemed as though it was inflammatory, not osteoarthritis. That was basically the criteria in a lot of these. They also wanted people with a certain amount of people that had ACPA positive, rheumatoid factor positive, RF positive. These are biomarkers in disease in rheumatoid arthritis in this case that have already been proven, not often, proven, factual, yes, that if those biomarkers are present, disease outcomes are worse. So understanding how to treat or possibly prevent onset, it was important to know what happens if people have these biomarkers versus don't. The bottom line is when they went through and tested using methotrexate in the beginning of disease onset, when it's in this preclinical phase, which also they looked into like family history. Do you have a parent or a sister, et cetera, with one of our diseases? So you're at risk. So if you were identified as at risk, you were included in this. And so they essentially found that after 36 months, that those who were the rheumatoid factor positive and ACPA positive, many of them went to actually develop rheumatoid arthritis. So they were not able to prevent, but they were able to delay what is typical. So they know that something worked. So now is research like, what do we do next? Do we treat more aggressively? So they've answered that question. However, interestingly, most of the people who did not have rheumatoid factor or ACPA positive biomarkers did not progress. They actually were able to say, nope, these people did not progress into rheumatoid arthritis, at least up until a couple years. So interesting there. And they also tested the use of I'm going to mess it up, hydrochloroquine to see if that could help with prevention. And they found no response, no matter biomarker or not. People did not respond to hydrochloroquine as anything that could stop RA. But what it did do is they did notice that regardless of the treatment arms or the people with the biomarkers versus not the biomarkers, that those people with the biomarkers were definitely more at risk. So they still gave more proof to the data that these people have a higher risk and they should be treated with some kind of disease modifying agent as early as possible, even when it's suspected it could be. So this is that preclinical, it hasn't even become full blown. The reason that I am like, yes, on this one is because of my story. I go back and I sat there with undifferentiated connective tissue disease. At the time, I probably had 12 locations all in my left body that I was in pain. My shoe wouldn't fit. It felt like bruising. It came and go. You know what it feels like. And I had the fatigue and I had low-grade fevers. I was so classically undifferentiated early arthritis that I wanted a DMARD. I wanted methotrexate. And my rheumatologist at the time said, nope, if I give it to you, it might help you. And then we wouldn't know what this would actually turn out to be. So that rheumatologist, in essence, messed up my life because I could have possibly went into remission. So I still am bothered by that, but I have to say I would have never founded AiArthritis if I would have went into remission. So there's a reason for everything, right? Anyway, that is my update on what's happening in preventing our diseases. We are really evolving and it is an exciting time in rheumatology.